Hey, all. So this is a follow-up podcast to the chest x-rays I posted a day or two ago. So this is an elderly patient that obviously has some issues. He came in with generalized edema, um, 2+ in his legs, arms, hands, etc. Turned out his albumin was less than 1.5 and um, just not having a good day all around. And his chest x-ray showed this, and I had also posted his ultrasound as well earlier a day or so before this that showed pretty significant um, pleural effusions, left greater than the right. And so I did a thoracentesis on him, both for diagnostic as well as palliative, because it was affecting his breathing, his dyspneic, and sats were going down, etc. But if you look at this chest x-ray here, which is what we're kind of focusing on, obviously. So starting with A, here's airway coming down. And looks like this is probably carina right about there. And you can see the aorto pulmonary window right here. And the carina is usually right somewhere in that area, which helps you locate it as well. And of course, you can still count down the vertebrae. uh, T6, T7, T5, T6 area is usually where you find the carina. So bones, we look at it, all the bones that are visible and don't see any fractures, ribs are okay, etc. The vertebrae, what we can see looks okay. I don't see anything unusual. And C for cardiac silhouette, you can see the silhouette here, good. You can see the silhouette here as well. And obviously, if parts of that were blocked by something, that would mean there's an infiltrated consolidation or something going on there, which you'd have to figure out what it is. D for diaphragms, and here's where it gets kind of dicey. I mean, this patient obviously more than likely has COPD as well, but you can kind of see the diaphragm down here. You can't really see much anything on the patient's left side. E for everything else, you can see lung markings going all the way out to the periphery on both sides, so you know there's not a pneumothorax, or at least you don't see a pneumothorax. It could still be one, but so you look down here, back down the diaphragms, and you can see that this is pretty much gone with that white fluffy stuff, and here's some more here as well. You have a bunch up here in the more so on the left side, a little bit in the right, but it's more infiltrates on the left-hand side there. And you also have infiltrate here, and looks like a smaller pleural effusion here. And the ultrasound bore this out. The left side had a moderate to large pleural effusion. The right side had a small pleural effusion. And here's a chest x-ray post-procedure, and you can see a dramatic difference in this left side. Still has a little bit of a pleural effusion. You can see this line of fluid across there and the blunting of that costophrenic angle. But I ended up taking out 1 liter of fluid, and he obviously felt much better. You can still see these infiltrates up here on the left side more so than the right side, but there's a little bit going on here as well. But you still have this infiltrate slash pleural effusion. You can see there's some fluid down here. I put the ultrasound on him today, and obviously he still has a pleural effusion, but it's a small pleural effusion. So a lot of this is infiltrate. So he's being treated for pneumonia as well, obviously. And that's it for the chest x-rays. Hope you guys enjoyed it.